NASS is on a mission to provide quality, effective patient care, and that's very similar to the goals of the Choosing Wisely campaign. One of the big goals of Choosing Wisely is to really partner the physician and the patient. The physicians and the patients are going to be looking at these guidelines, and they're going to help make informed care decisions together based on best available evidence as summarized by these guidelines.
To help further the conversation, NASS is pleased to join the Choosing Wisely campaign. Choosing Wisely, an initiative of the American Board of Internal Medicine Foundation, was created to help physicians and patients engage in conversations about the overuse of tests and procedures and support physician efforts to help patients make smart and effective care choices. To date, more than 50 medical specialty societies have joined the Choosing Wisely initiative.
We recognize that physicians have an obligation, professional, a moral, and ethical responsibility to address these challenges for their patients.
Well, let's face it, patients come to us now with lots of information. The internet has really changed the patient-physician interaction. And because of that, patients have some expectations of you which may or may not be most appropriate for their particular case. So I think the Choosing Wisely program is good for members of NASS because NASS has put out some items there that are things that pretty much anybody would agree to are important for patients to know about their care and why certain tests are ordered or why certain treatment is or isn't recommended.
Growing evidence suggests that patients who are involved in the decision process are happier with their decisions. They have better outcomes and the cost of their care are less. Encouraging patients to discuss the tests and procedures is important in choosing their care and also discussing procedures and tests that are not necessary or perhaps could do some harm. I think it's the start of a very important partnership between physicians and patients to optimize care.
The NASS Choosing Wisely list was created with a task force. We began to look at issues that impacted providers, referring physicians, and third-party payers, and attempted to define ways to make that more efficient and more practical.
5 things physicians and patients should question. Number 1, don't recommend advanced imaging of the spine within the first 6 weeks in patients with nonspecific acute low back pain in the absence of red flags. Number 2, don't perform elective spinal injections without imaging guidance unless contraindicated. Number 3, don't use bone morphogenetic protein for routine anterior cervical spine fusion surgery. Number 4, don't use electromyography and nerve conduction studies to determine the cause of axial lumbar, thoracic, or cervical spine pain. Number 5, don't recommend bed rest for more than 48 hours when treating low back pain.
Choosing Wisely is just one example of the many things that NASS has to offer with advocating for quality spine care, as well as advocating for members to be able to deliver quality spine care. All those things are available for folks who are taking care of patients with spine disorders and are available on our website at NASS.